A child who receives a school meal in education but drinks contaminated water at home will likely fall sick and miss school, negating the benefits. Focus on hardware and software. There is often a tendency to focus on visible, there's often a tendency to focus on visible capital projects, hardware, like constructing new health centers or ECD classrooms. However, this is often not matched by recurrent funding for the software, that is, the trained teachers, health workers, essential medicines, and learning materials that make the buildings functional. This leads to well built but under resourced and underutilized facilities. Thirdly, inefficient targeting. Social spending is not always laser focused on the most vulnerable. Universal subsidy or bursary programs can be captured by the less needy, while the households facing multiple deprivations remain unreached. Without precise data on who and where the most deprived children are, resources are spread too thinly to make a significant impact. Fourth, population growth and external shocks. In some cases, population growth may outpace the increase in spending, meaning the pre-child investment remains stagnant. Furthermore, external shocks like floods, a major issue in Kisumu, drought, or economic inflation can quickly reverse any gains made, pushing families back into poverty. There is some competitive voice coming from there. I don't know who it is. Can somebody switch off that radio? Somebody's giving a side lecture over there. Now, we should adopt an integrated service delivery model. Instead of departments working in silos, we must implement a convergent approach. This means different sectors coordinate to deliver a package of services to the most vulnerable households simultaneously. In Kisumu, we have piloted this coordinated budgeting approach where we encourage interdepartmental activities. For example, our Department of Agriculture is working with our ECD schools to implement agricultural practices that are exciting to children like conical and kitchen gardens. These gardens, besides providing the schools with nutritious foods for the learners, also help to introduce them to agriculture. Likewise, the Department of Water is also obligated to bring water supply to the schools to improve sanitation and also to be used to irrigate the gardens. The community health promoters, agricultural extension officers, and social protection officers also work together in the communities to identify the most deprived households and work together to ensure the children are immunized and attending health checks. The family has access to clean water and receives climate smart agricultural support. This creates a ring of protection around the child. Two, prioritize investment in the software. A functional facility is better than a new non-functional one. Our budgeting must reflect this. In Kisumu, for every new ECD classroom built, the budget must automatically include provision for a trained and salaried teacher and necessary learning materials. For every new health dispensary, there must be a guaranteed recurrent budget for a full stock of essential medicines and qualified personnel. This means prioritizing recurrent expenditure for service delivery over excessive new capital projects. And now with FIF, we find that commodity supplies to health facilities is sustained. Thirdly, focus on household economic strengthening. Social protection should be a springboard, not a permanent safety net. In Kisumu, we have since learned that freebies are not sustainable. In agriculture, we have introduced a subsidy funding model for inputs. We have partnered with Equity Bank for a subsidy wallet whereby farmers are linked to registered stores for various inputs. With their wallets, they pay a percentage of their needs, and the county government supplements a percentage directly to the store through the bank. This encourages ownership and commitment on the part of the farmer. This builds families' economic resilience, empowering them to eventually pay for services themselves and graduate out of poverty. Having shared my thoughts, allow me to resume my seat briefly and be enriched by a contribution from the great professionals who are here to share their insights on this and related subjects. But that will be very brief. However, as I mentioned in my opening, the bodies from that accident are being removed today from the morgue, and as the governor, I want to share the moment with the families at the mortuary, which will be taking place at around 11:30. I will then have to excuse myself before the conclusion of this discussion to be in Kisumu in time for that solemn moment. Thank you very much, ladies and gentlemen. I wish you a very fruitful deliberations, and I wish you a very happy stay in Homa Bay, the county of endless potential. Asanteni sana, Mungu wabariki.
Thank you so much. Let's give him another round of applause, Your Excellency, for the interventions that you are implementing to improve the welfare of children, and also the duty that is ahead of you that you're going to accomplish in the next few hours. Thank you. Ladies and gentlemen, we now get to the next speaker. Allow me to welcome the board chair of KIPRA, Professor Paul Wachane, to move forward to the podium and welcome our keynote speaker, the Principal Secretary, Dr. Boniface Makoha, State Department for Economic Planning. Karibu sana, Prof. Let's give him a round of applause. Yeah. Oh.
Thank you, the moderator. So, good morning. Thank you. The Principal Secretary, State Department of Economic Planning, who is our chief guest, Dr. Makoha Boniface, Principal Secretary, State Department of Children Services, Corin Okego, His Excellency, the Governor of Kisumu County, Professor Peter Nyang'anyong, the National Development Partners present, of course led by UNICEF representative, the national government officials present, county government officials in the House, delegates from various agencies in the House, na watu wa Homa Bay, hamujambo. Good morning. My task today is very simple, basically to welcome our guests. And like as I looked at the theme of this site event. That is financing the social sectors for equity and inclusion. I was asking myself, are we all on the same page in understanding, in fact, what the theme is all about? The key recipient of the social sector investments, those are the G-train, right from unborn all the way to reaching the social services transfer payments. It raises a lot of critical issues or questions that need to be addressed. Right from our priorities in terms of investment in the health sector, nutrition, social protection, water sanitation, and energy. The question is, does our national government, that's Kenya, prioritize these resources, or is just a matter of pumping the amounts of its part of its budget? Or which sector or which aspect is majorly favored in this budget allocation? Is what we are doing at the county government reflects the best practices as we look across the globe? Is there a mismatch that needs to be linked up? So those are some of the things that as participants today, I will be interested in understanding whether that's being done and this implication on the children's health and basically status. Without going into much details, of course, I had made some things I had wanted to ask His Excellency the Governor, but he was gracious enough to tell me that I should reach out to him, either face him or email him. Key that I was going to ask, especially those at the county governments, the CECs, that as Kipra, we are focused on public policy research analysis. That's developing tools from which we could get regulations enacted or which could guide our priorities. So we are calling upon the counties, the leadership of counties, to consider in their gracious way allocating some budget, be it 1% of their budget to Kipra, so that Kipra can come and provide capacity building in these important sectors. And will not limit ourselves, of course, to the issues of children, but will go beyond that. So providing capacity so that the county governments are better positioned to intervene in matters of children health, among other things, would be a critical opportunity and a critical priority. So with those few remarks, my job was basically to welcome our PS to come and make his remarks. Then the director, of course, Elder, will provide the technical aspects of what's required. So at this point, I would like to invite the PS, Principal Secretary, State Department of Economic Planning, our boss, Dr. Boniface Barasa, to come and address the gathering. Thank you, Dr.
Thank you, Prof. Before I start, I want to join the governor of Kisumu, who has just left, in condoling with the people of Kisumu for the loss, and by extension, Kenya, uh, I believe there is a moment. Okay, thank you. I believe that the loss is very devastating to us. We need to join in and mourn those who are mourning. Having said that, I want to take this opportunity to acknowledge the presence of excellencies. If we have any governor or the representative, I also want to acknowledge the presence of my colleague PS Karen, members of parliament, honorable members. I saw Honorable Atandi, senior government officials present, DGs, CEOs of parastatals, led by our own DGs, that is from Kipra and KNBS. Ladies and gentlemen, good morning. It gives me a great pleasure and privilege to join you today at this important side event dubbed Financing Social Sector for Equity and Inclusion at Devolved Level, co-hosted by the United Nations Children Fund, UNICEF, and UN Women at the sidelines of this Devolution Conference. Today, as we gather to the debate on how better to finance social sectors, as we also launch two critical reports prepared by the Kenya National Bureau of Statistics, and these two reports are on the title Brighter Tomorrow, Breaking Cycles of Poverty for Kenya's Children, and the second report is on Women's Empowerment report. As you may be aware, the State Department for Economic Planning, of which I am in charge, is mandated to, among other functions, to manage the national statistics as well as undertake national census, economic and housing survey. The State Department undertakes this function through KNBS, the Kenya National Bureau of Statistics, whose key mandate is sector-specific data collection, report writing, and dissemination. It is within these confines that in the year 2024, KNBS, with the support of UNICEF and UN Women, initiated a study to provide the required evidence on social sector performance. Both the financial and non-financial indicators were dealt with. The study inspired by the need to monitor one of the core goals of devolution, promotion of physical equity and accelerating poverty reduction across all regions of the country. Distinguished ladies and gentlemen, are at the heartbeat of our nation's future. To secure that future, we must understand how they grow up and whether we truly meet their needs. The Brighter Tomorrows, Breaking Cycles of Poverty for Kenya's Children report draws data from the latest Kenya Demographic and Health Survey, that is of 2022, and applies the UNICEF's multiple overlapping deprivation analysis to provide a comprehensive picture of child vulnerability in Kenya today. The findings show that Kenya is home to 21 million children, of which they form 42% of the population. While notable gains have been made to ensure that child survival education protection is guaranteed, a significant proportion of Kenya's children continue to face poverty and nutrition, inadequate access to basic services, and other risks that threaten their well-being. More than half of Kenya's children are multidimensionally poor, experiencing deprivation in at least 3 dimensions of their well-being simultaneously. These disparities are stuck with children in rural areas being more than twice as likely to be multidimensionally poor compared to their urban counterparts. If you look at the percentages, they are 66% in the rural areas compared to 28% in the urban areas. The regional inequalities have persisted, with counties such as Mandera, Turkana, Samburu, and Wajir reporting deprivation rate exceeding 90%. While on the other hand, counties like Nairobi, Kiambu, and Nyeri have the lowest rates of this deprivation. This highlights the urgent need for targeted and equity-driven interventions. The report further shows that only a small fraction of children benefit from social assistance program. In fact, indicative findings from the physical incidence analysis reveals that poorer households receive less government spending on essential services, especially education and health. And this report was presented, I think, the other day by Kipra. A very detailed analysis was presented on this, so I believe we can also have opportunity to look at it. On the positive, the report highlights that early childhood development spending is a smart investment. It is worth investing in the young population as a priority to reduce inequality. Similarly, apart from the report on the children, the Women's Empowerment report highlights also a critical but often overlooked fact. Women's empowerment is a necessity. Women's empowerment plays a vital role in advancing gender equality and driving sustainable development. Empowering women is not only a matter of equity, it is a powerful catalyst for social change as well as a strategic investment for child survival and development. And I want to remind us that that is why we have even a resolution from the UN, resolution 1325 of the UN Security Council, that is specifically on matters to do with gender, where women empowerment is given a priority. The analysis of women's empowerment in Kenya report was based on data from the 2022 Kenya Demographic and Health Survey report. As established in the analysis, 40.6% of women in Kenya are considered empowered. Women in urban areas, those with a higher level of education, and those from the wealthier households tend to be more empowered. highlighting a significant disparities when you compare with those from the rural areas. The analysis also establishes a clear link between women empowerment and better outcome for their children's future. It was observed that empowered women are more likely to ensure their children receive essential services such as health and education. Thus, they are less likely to be multidimensionally poor. Specifically, when women have access to resources, decision-making power, and social support, their children thrive. And you will agree with me and allow me to come to bring us back home here in Homa Bay. The governor is a woman, and us people of Homa Bay, yeah, we are thriving. Ladies and gentlemen, these findings call for urgent action. I therefore echo the recommendations in the report, which include: 1, expand inclusive child benefits. Move towards universal systems that reach all vulnerable children. 2, improve access to health and nutrition, especially in poor and rural households, through immunization, food supplementation, and caregiver support. 3, reduce educational disparities by investing in infrastructure, teacher training, and inclusive education, particularly for children with disabilities. 4, strengthen child protection systems, including mobile birth registration and support for child-headed households. 6, build climate resilience by integrating child-focused adaptation into disaster preparedness and the education system. And finally, promote women's empowerment as a cornerstone for child development through targeted social, economic, and policy intervention. As I conclude, ladies and gentlemen, I wish to extend my sincere gratitude to UNICEF and the UN for their continued partnership and commitment to advancing children and women well-being in Kenya. Special thanks to KNBS team, KIPRA team, for the analysis and the production of the 2 reports. The evidence is clear. The time to act is now. Let us commit across government, development partners, and of course, including civil societies, to ensure that every child in Kenya has the opportunity to thrive and that every woman has the power to help them to do so. Thank you, and I wish you a fruitful deliberation. Santeni sana.
Let's give another round of applause. It is indeed the time to act. The time to act is now. With a few people behind us who are too scattered behind the main dais, we're asking you to come forward. There's plenty of red seats, The people behind, please join us because we're getting to the happiest moment that I'm going to announce in the next few minutes. Thank you so much, PS, for those kind words. Thanks so much. For the recommendations. Thank you so much for even much more suggestions that we can consider as we move forward. with financing social sectors for equity and inclusion, a side event that is brought to you by the UNICEF, UN Women, KIPRA, the KNBS, and the World Bank, with support from development partners that include the Conrad Hildan Foundation, the Podcast